When I was a freshman, like most other freshmen of course, I took pre-AP biology. I wouldn't say that I was exceptional at it, but I caught on to the topics fairly quickly. I was one of the few freshmen selected to go on the genetics field trip with the AP biology students. It was brilliant. I learned so much about genetics and how the subject relates to cancer and other medical ideals. The professor also talked about the shortage of organ donors in the United States, leading him into tissue engineering, or the replacement or improvement of biological tissues using engineering methods. In other words, you can basically grow organs using genetics. Tissue engineering, I learned, is just a subgroup of the broader field of biomedical engineering. Hello, and welcome to my ISM presentation. My name is Madison Gray. I'm a junior this year, and I've chosen to study biomedical engineering in ISM, having been inspired by a simple 9th grade field trip. For those of you who don't know, biomedical engineering is essentially the practice of using engineering and biology to create pharmaceutical medicines and healthcare technology. I took ISM because I wanted a chance to decide if I belonged in the engineering field or the medical field, or perhaps even both. Throughout my ISM journey so far, I've been conducting a boatload of research in the form of both interviews and articles. For my first interview, I met with Jessica Sampson, a mechanical manufacturing engineer from Orthofix. She was a mentor last year for another student studying biomedical engineering, so I figured that she would be a good place to start. She was the first to teach me about the importance of communications in engineering, and that it's not just the science and math aspect, that you have to learn how to articulate what you want in order to get what you want. She was also the first to suggest that I start broad. She told me that I have to study mechanical engineering in order to allow myself more career options in the future. After Jessica Sampson, I turned my studies around quite a bit and interviewed Dr. Erdal Toprak, a professor and researcher at UT Southwestern. His research was incredible. He was trying to discover why cells become resistant to antibiotics and how it can be prevented, working particularly with E. coli. He suggested that I get involved as early as possible, that I seek internships and lab work while I'm still in high school so that I can get a jump start in college. He also said that even though it's biology I'm interested in, he told me to make sure I have that background in chemistry and physics just to get that mathematics base. Again, he uses communication skills in order to get funding for his research. Following Dr. Toprak, I conducted an interview with Elizabeth Grumman, senior mechanical engineer at St. Jude Medical, and her team of female engineers. The fact that all of them were women really appealed to me because 50 years ago, women didn't have the opportunities that they do today. And it's incredibly important to society that women develop in STEM fields and positions of power. One member of the team suggested that as a female, I should not be afraid to speak up to the team and ask questions, no matter how many men I am working with. Because as long as I am knowledgeable about my field, it won't matter if it's male-dominated. I will be just as qualified to be there. They also talked about meeting people who benefit from their medical devices, reminding me just how important an engineer's job really is. My fourth interview was with Dr. Michael Reese, a professor of pharmacology at UT Southwestern who is researching toxoplasma, a parasitic protozoan that can be transferred from cats to humans. Though it was my shortest interview, I believe this one was the most informative. Dr. Reese told it like it was. Life as a scientist is not easy and it's not glamorous. He taught me to balance my time between my needs and my wants. He taught me to keep an open mind because most people have more than one career, and I'm allowed to change my mind. He taught me that learning how to code my own programs will allow me to evaluate my scientific data with ease and accuracy. My fifth interview and my final interview was with Dr. Shashank Searcy, bioengineering professor at UT Dallas. He is researching image-guided drug delivery, or the process of using high-frequency sound waves to detect cancerous tissue and reduce chemo intakes to just that cancerous area. In my time of doubting that I was smart enough to be an engineer, Dr. Searcy showed me that engineers don't have a designated skill set. He reminded me that cutting-edge research is why we're there. Scientists need to have the drive to work in order to make the innovations that we make. I think I have that drive. My interviews with professionals led me to understand exactly what kind of research I needed to conduct in ISM and exactly what skills I needed to adopt in order to be a successful engineer. When I completed my original research assessment on the career outlook of biomedical engineering, I had no idea how many subfields there were. Honestly, I just can't wait to explore them all and decide where I truly fit, where I could truly make a difference. So I jumped right into the challenge. Of course, I've been interested in tissue engineering since my field trip, so I conducted research on how it is modernly implemented. Tissue engineering can help heal wounds, repair stem cells, and provide an alternative method to animal testing, which is an incredibly important issue in this day and age. Personally, I believe tissue engineering could be revolutionary for spinal cord injuries. If there were a way that the spinal cord and its nerves could be reconstructed using tissue engineering, the outcome would be revolutionary for modern-day science and medicine. Following my interview with Dr. Toprak, I conducted antibiotic resistance research and learned that the mutation of cells can cause premature antibiotic resistance, even if the antibiotic is not yet present. In addition, transformation, a process in which DNA is released by dying bacteria to be taken in by other bacteria, is known as the leading cause of resistance to penicillin. Finally, plasmids are pieces of DNA that can replicate themselves and encode the replication into another cell, and are known as another major cause of antibiotic resistance. And in this diagram, you can see that a bunch of bacteria here are resistant, and that the normal bacterium are more abundant, but then they get bathed in antibiotics, which that's a huge problem because doctors prescribe too many too quickly, and then the normal bacteria die, the resistant bacteria multiply and become more common, and eventually there's a resistant strain. Before my interview with the engineering team at St. Jude Medical, I conducted research on neuromodulation, the area that the Plano branch of St. Jude specializes in, so that I would be better prepared for the meeting. Neuromodulation, also known as neurostimulation, is the process of stimulating the spine using a small electrical system in order to relieve chronic pain. Such technology and therapy boasts modernism, such as compatibility with smartphones and a rechargeable battery. You can also update the software on the system inside your back without having to take it out. The system is implemented surgically, and neurostimulation can be used to assist the paralyzed with limb movement, which is a major medical innovation that could eventually and potentially reverse paralysis. Other biomedical innovations that I've researched include spinal regeneration, balloon therapy to stop excessive menstrual bleeding, computer electrosensing to detect breast cancer cells, and Lyme disease vaccinations. However, I've also realized how knowledge of mechanical engineering is vital to succeed in biomedical engineering. For this reason, I've also conducted research on robotic applications in medicine. Robotics could potentially be lifesavers in hospitals, from preventing human error in surgery to assisting with physical therapy. As you can see, there is nothing about my topic that doesn't excite me. Despite the importance and relevance of the research I am conducting, it is very hard to truly learn about science and technology without that hands-on learning experience. I am truly excited to be able to enter a mentorship with Dr. Erdal Toprak and get that real-world experience that I've been waiting so long for. I believe that this is the only way I will be able to determine if I am good at biology and if it is right for me. Throughout my research, I have learned so much about my topic that I never would have otherwise heard about from just sitting in a classroom. My interviews were able to give me insight into the world of biomedical engineering, as well as science in general. It was truly an eye-opening experience. Following all of the other amazing things that happened throughout ISM, I have also completed an original work project. I decided to tackle a medical issue that affects my father in our own home. I decided to go with a common condition called arthritis, which joints are inflamed and cause pain to the hand or knees. He finds it difficult to open jars, lift glasses, and grip tools. Although he has tried arthritis gloves in the past, he has often complained about how they are uncomfortable and do not relieve any of his pain. Therefore, I decided to create a pair of arthritis gloves that use tension bands in order to relieve chronic pain and make lifting objects easier for him. After completing quite a bit of research on fabric types, I decided on a lightweight, compressible fabric for the gloves that was composed of polyester, rayon, and spandex. This would apply light pressure to the area and keep the hand warm overall without it being uncomfortable for the wearer. Following that, I cut up an old pair of my dad's gloves that fit him perfectly, and I used that as a template for the pair that I was creating. I cut apart the back of the hand, I cut out the thumb, and I laid out the template, and then I traced that on cardboard, and then I cut out the cardboard, and I used that to create new pieces of fabric. The tension bands that I wrapped around the outside of the hand apply pressure to the area of affliction in order to relieve his pain. Although not part of my original design, I also ran wire along the inner thumbs of the gloves to prevent sudden movements that would harm someone with thumb arthritis. My design and tangible product was proven to be effective by my father, who noticed that his hands experienced enough relief that he could once again perform simple tasks that used to harm him. The objective of this project was to challenge myself to try engineering principles that I would follow in a similar career. I wanted to learn how to research, design, obtain materials, take measurements, and create a product that would help people in need, as is the entire purpose of me becoming an engineer. And I did exactly that, learning so much along the way. If this product were to be improved and developed properly and professionally, I truly believe that it could be extremely useful to people in the world who have arthritis. As I mentioned before, my mentor's name is Dr. Erdal Toprak. He is currently the Southwestern Medical Foundation Scholar in Biomedical Research at UT Southwestern's Green Center for Systems Biology, where I am currently serving as an unpaid intern. He has an undergraduate degree in physics, and he received his PhD in computational biology and physics from the University of Illinois at Urbana-Champaign in 2007, where he studied motility mechanisms of molecular motor proteins. After attending a marine biology lab in Massachusetts, he moved to Harvard Medical School as a postdoctoral research fellow and studied the evolution of antibiotic resistance in Roy Kishoni's lab. My mentor-to-be's information was given to me by our very own Coach Goff, as he used to be a mentor for another student in the ISM program about 3 years ago. Throughout our interview together, I just knew that he was the person I could gain the most from as a mentor, and I was absolutely right. Though I've only had 2 mentor visits, I have learned more about biology and its applications from Dr. Toprak than any other person my age in a biology classroom. He wants me to truly be able to understand the information that he is providing me, especially in a lab setting. So far, I've already been able to work with the lab equipment and learn all of its uses, and I can't wait to continue working with him, his team, and E. coli and how it relates to antibiotic resistance in his lab. I am incredibly grateful to Dr. Toprak's willingness to take time out of his day to ensure that I am learning with him. I could not have asked for a better mentor. As of right now, I want to study engineering in college and eventually work for the United Nations. Despite this, I really don't know where I'm going, and I took this class because I wanted a chance to find out. I don't think anyone has one set path or final destination. There's time to learn and change your minds, and you can change it 1,000 times. Throughout this experience, I've learned so much about my topic of study, but even more about being a versatile and diligent human being. So what do I want to do with my life? I want to do good. As N.R. Narayana Murthy once said, we all, as engineers, doctors, have a big responsibility to bring smiles on the faces of suffering humanity. Thank you.